Leaving that MD seat was very difficult. It was a leap of faith, obviously.
There must be multiple opinions and voices coming from outside.
At the end of the day, you know what you're going through. So you should be there for yourself. Even if you have to go against your parents about this, that's completely okay.
If you believe in yourself, everything is possible.
My internship is pretty hectic. That's when Salaah Shots also came into picture. Making a proper schedule is the most important thing that you can do in your practice. So there's this mentor, Dr. Anisha. So I used to book a session with her. I just show her the schedule. This I've made. Do you think this needs any changes, or is it okay? Yeah. She or Salaah Shot gave me that assurance that whatever I'm doing is right, and wherever it needed modification, she used to tell. Surprisingly, there was a elevation in my score from usual 130s, then it was 150s, and lastly it was around 160.
Hi Kartik, thank you for coming for this podcast. And the whole reason to start this podcast is to give your story out. There's so many people who are going to sit for exam next year and post that, and you have a journey which is full of ups and downs, and they can find a lot of relatability from here. कि आपने क्या गलती की वो जो उन्हें रिपीट नहीं करनी है, एंड इट्स ऑल अबाउट कि इफ यू कैन डू इट दे कैन डू इट टू. सो यू आर गोइंग टू बी a source of inspiration for so many people. So let's try to uncover this story which nobody talks about but everyone goes through. So we will bring that out, and I want you to introduce yourself first, and then we will start the conversations.
Okay.
So with you.
My name is Dr. Kartik. I completed my MBBS from Government Medical College, Haldwani. And this was my post-internship attempt. I did prepare during my internship, but my internship attempt didn't go that way. So I took a gap year, and then here I am with the rank of 756 in this NEET PG.
Wow. Congratulations for the rank. What was your post-internship rank? No, internship rank, sorry.
My internship rank was 9,041.
So if we'll take that rank, just from that question, 9,000 is not a bad rank per se to take any college, right? And with that rank, when you were taking a decision that, okay, I have to take a drop, because you know that drop year is full of ups and downs, a lot of uncertainty. And so do you also have that thought ki kya pata next year मेरे को ये भी नहीं मिला तो इससे भी खराब rank आई तो?
Yeah, I was pretty much uncertain about it. So when I got the result last year, in 2024, I was not at all satisfied because my attempt was not good. I mean, there were a lot of things which went wrong at the very last moment, like changing of the city centers and everything. Last year was extremely chaotic. Everyone knows about it. But yeah, so I thought maybe I can do better. Though, since I belong to a non-medical background, so my parents were like, hey, you can move on, you can take up a branch, and then maybe you will like it or something. So I was not fixed upon anything particular. The only thing that was problematic to me in the entire scenario was it was not my very good attempt. The attempt I would say, I gave my everything, nothing more I can do about it. So that's why, even though I attended the entire counseling last year, I got DNB pediatrics, then I got pulmonary medicine, then I got DNB medicine, general medicine, then I got pulmonary medicine, and in the last round I got pediatrics, MD pediatrics. Leaving that MD seat was very difficult. I took that decision in mid-Feb. I mean, initially my parents were not that much supportive, but eventually they understood my point of view and they were pretty much supportive about it. Hence, I took the decision, and it was a leap of faith, obviously, because you never know what will happen. Maybe it could have gone worse, obviously, but yeah, it did go well. So
I'm so happy for that, because I know ki coming from, you have combination of all the things which make things a bit difficult. One is coming from a non-medical family, and then another one that you already have a rank, you are getting a college, why you are not taking it? You might be there must be multiple opinions and voices coming from outside कि बहुत overconfident हो रहा है, and a lot of what will happen, what will not happen, we shouldn't let the opportunity go away and all. And then navigating all through and just having a faith on our own self कि मैं इससे better कर सकता हूँ. That makes a lot of difference. And I think this is the second story I'm listening like this. There's a story of Sankalp even leaving his pediatric seat.
Yeah.
And then I'm so proud listening to this, that one thing I really believe in, that if you believe in yourself, everything is possible.
That's true.
So if you can just go back to your day when the result came out, how was that day?
Okay. So the thing was, I was actually sleeping because there was a lot of stuff going around on Telegram, on WhatsApp, a lot of groups that the result will be coming this and then. There was no fixed date because the date they've given is 3rd September, which was way ahead. Usually the result comes in 10 to 15 days. So every day I used to like wake up, check Telegram, and there used to be these rumors, notices circulating around. So that day I was a bit fed up of all of this. So I was like, plus I like cancelled a trip of mine just because so the result came on Tuesday. I was expecting maybe it will come on Monday. So I cancelled like one of the trips I was supposed to go to. I was already a bit frustrated from that. So I was just sleeping on Tuesday. And when I woke up like at 5 or 6 p.m., the results were out. Telegram was flooded with messages. I was obviously like a lot panicked about it. So then I checked. So that was also not downloading. So I went downstairs with my parents. I sat. They calmed me down. Then we checked the result, and I was like extremely happy. I mean I knew that I might get a better rank maybe, but yeah, I mean it went really well. Plus, yeah, one thing was there. So I couldn't check the recalls of the exam due to some of my family emergency. I was in hospital for a week or so after my exam. So the thing was, I could not check the recalls. And when I came back, I used to hear from almost from everyone that the paper was very easy. This was a very common notion among everyone. The paper was very easy. But when I attempted the paper, I felt it was moderate difficulty. I did not find it easy. So kahin na kahin, I was like deep down, I was like, कि शायद मेरा paper खराब हुआ है, because everyone found it easy. I am the only one who is finding it like moderate to difficult. So maybe I will be getting a worse rank than that and everything. But yeah, it turned out well, thankfully. So happy about it.
Happy about it, really.
Yeah.
So if we'll go back to the prep days, when you took a drop, how the things started, like where was your GT score and how have you improved? What was your GT plateau days or stuck story?
Okay. So during my internship attempt, my internship is pretty hectic in GMC Haldwani. The internship is pretty hectic in certain departments, especially. So I did not do the main notes of everything. I had to use a like concise source. So I started up with BTR and rapid revision notes of mine. So when it started, I used to give tests very periodically whenever I'm having an off day or something. So maybe like once or twice a month. I was not like very like serious or rigid ke her weekly I have to give a GT or something. It wasn't like that. So when I started up, my GT scores were around maybe 100, or something. By the end of, so yeah, last year also it got postponed. So by around like March 2024, it reached to 130s, and I was in that range only, in 130s only. So after I gave my NEET, so in my NEET PG last year, I got 152 corrects, which was like a very good jump from my usual GT score, almost like plus 20. So one thing was clear in my mind, that GTs are pretty much different from the main exam because the exam day matters a lot.
A lot.
So this time, last year I remember I used to watch a lot of videos about GT analysis and GT approaches and stuff. And what I used to do was I tried very hard to put myself in those shoes, do exactly same things. Okay, maybe I will also like reach 170, 180 that mark. But that never happened because those things didn't work out for me. So this time I was pretty clear. Okay, I have to approach GTs like it is a GT. It is not my main exam. This will not be deciding my future at all. So with that mindset, surprisingly, I jumped. There was a like elevation in my score from usual 130s. Then I was on like 145, 148. Then it was 150s, and lastly it was 160, around 160. Yeah.
And then what was your main like exam score?
In my main exam, my corrects were 166.
So it was somewhere like plus minus 5,
Yeah.
6.
Yeah.
Yes. So fair enough. And so the way you said that you were not very that way that every week I have to write a GT. So what exactly was your day or your month? How you used to plan it? And if you can just bring that
Okay,
out.
like after my drop, like
Yeah,
attempt. Yeah.
is this drop attempt?
Okay. So, I am someone, matlab, when I wrote November INI last year, I got a rank of 1111, which I was not expecting because May INI, my rank was 10,000. So, like 10 times it got better. So, what I did was I was pretty much stuck with the proper schedule. I feel making a proper schedule is the most important thing that you can do in your prep phase. So,
Okay.
how I like used to divide stuff is I would like I'm doing a revision, like first or second cycle of my revision. I should know how much days I'm gonna give to one subject. Then in that also, I should know what my like what every day of mine look like, and that I used to like decide a day before only. Like before sleeping, I used to like so this I had this diary.
Hmm.
On this, I used to write everything. So what all tasks I have to do. So my day, it used to start with a custom module. I used to do a 50-question custom module the moment I wake up. And I used to give myself a window of 1 hour, and that I have to complete the module, plus I have to review it also. After that, I used to read pharmacology for 1 hour. So that way, I used to complete my pharma. I completed my multiple revisions of pharmacology in like 10 to 12 days because one unit I used to do every day. Then I used to do my morning course, then having breakfast and everything. Then I used to sit at 10. 10 to 1 would be a stop. That then I'll take like maybe a gap or till like 1:30 maybe. Then I'll have my lunch. Then I'll take a nap or I'll watch something. Matlab, just maintaining myself. Yeah. Uske baad I'll sit from around 2:30 to 6:30 or so, like 4 or 4.5 hours slot. Then I'll have uh, then I'll have coffee. I might go out for cycling, for walking or something. Sit with my family, something like that. Or again like watch something. And then by the end I'll have my dinner. And then I used to like passively watch a video, like academic video or something. And then I used to sleep. Yeah, that's all.
The way you said that you used to make your to-do list a day before the day you
Yeah.
were sleeping or making one day ahead of the to-do list.
Hmm.
So there you also have a monthly planner that what all have to complete in a 1 month, or what I have to complete in a week. So how the like long-term vision and the short-term vision you have inclined and inculcated that okay, this my day should look like.
Yeah. So I used to use A4 papers and I
Hmm.
used to stick like the monthly schedule in front of me. The advantage with that I feel is you know your plan. I mean, you're not like lost that what I have to study today. And even if if you have left something, I mean, you cannot complete everything. I mean, maybe like 2 3 days have been there when I've completed this list entirely. Always there used to be like 2 or 3 things which I've left. Maybe PYQ session, yeah, something like that have been left. But then you know that okay, whatever is left, you need to find like that time slot somewhere in future to
Hmm.
complete that. So I feel that gives you a very good strategy, and plus you're not dependent on like someone. Matlab you know your plan, you have to stick to it and complete it no matter what.
Fair, fair. And if we'll talk about that, what were the difficult days for you, difficult times in the prep? Do you also face like self-doubt or this
A
FOMO?
lot. I mean, I'm someone who doubts himself at every moment. I mean, when I like starting up when I dropped off my seat, thankfully my parents were supportive. So then only I took this decision because I was always like 50. I could not decide things for myself. That's when Salaah Shots also came into picture. So the thing was, whenever I used to make this monthly schedule, so there's this mentor, Anisha, Dr. Anisha Galhotra ma'am. So I used to book a session with her, and I would not ask like what to study, how to study. I'll just show her the schedule. This I've made. Do you think this needs any like changes, or is it
Changes?
okay? Yeah. So that way, I mean, she or like Salaah Shot gave me that assurance. Okay, whatever I'm doing is right, and wherever it needed modification, she used to tell me like pretty honestly. So yes.
Yeah, I think this also I believe कि when you have a clarity what to do now, so ये रोज के छोटे छोटे stress कम हो जाते हैं because we know
Exactly.
कि I'm on a right track. I
Hmm.
might be 1 or 2 days lagging behind in this, but at least I'm on a track.
Hmm.
So
Completely.
yeah, fair. And do social media have an impact on this? Ki FOMO wala, do you also fall into trap of multiple resources?
I
Ki,
so I used to. So this is the advantage with drop attempt. You have a lot of wisdom in you. So I did fall in a lot of such stuff because on Telegram there are endless PDFs being circulated, and all of them are like pretty good. Whenever you read that, you just feel like इसी से आने वाला question. I should do it definitely. But I've done it like last time when I did it. I had like maybe for one subject I had like 15 to 20 PDFs, which was in itself very much overwhelming. कि आप last में कैसे इतना कुछ cover कर पाओगे? So this time I was like pretty clear कि I need to stick to one resource. It's not I have not used multiple resources, but suppose I've taken anatomy. I did it from BTR. I did it from main notes of Ashwani sir. But what I've done is I made one single PDF of it. I don't have to know like इधर उधर नहीं जाना पड़ेगा बहुत ज़्यादा. That one PDF was my one stop resource for anatomy. That way. And social media. So I don't use social media a lot. So I've had mental health issues a lot in past. That's when I distant myself a bit from social media. I just use it when I have to upload my pictures and not see anyone else's. That's all. But yeah, social media did not play like much of a hurdle in my job.
yeah, because you have like, very disciplined, but at least you have controlled yourself from getting influenced from there. It's very important to have a check on how it's impacting us. So coming back to when you say that there are a lot of content to consume in any social media, Telegram topic, what is your take on having consuming a lot of content versus solving lots of questions? What one should approach and how they should plan it?
Okay, so I feel the recent NEET trend is changing. It is becoming more of an INI exam, to be honest, where you do not need to know a lot of content. I mean, it's not about depth or like breadth. You need to have a rectangle sort of a thing, adequate depth and adequate length of stuff, whatever you are reading. You don't need to cover a wide range of things, every possible, which once in a lifetime sort of a disease. You don't need to do that much. Plus, you don't want to do PhD in one subject also. I mean, you should need to have a balance of it.
So can you tell more about that triangular approach? Because it might benefit more people when they watch it.
Can you just repeat it once? I mean, it got lost.
Yeah, so that triangular approach which you said, so if you can just emphasize more on that, how to make that, how to understand that this is the enough depth, this is the enough breadth.
So I feel PYQs play a very huge role in that. I mean, there's an app called Marrow. It gives you the proper explanation of things. And if you're solving PYQs from there, you know, okay, matlab, itna content is more than enough. If you're going more beyond that, then you're basically like investing a lot of your time into one topic which is not needed, which will not be asked. I mean, this is the line one should draw. I mean, you should. I mean, the thing that used to interest me a lot was pathology. During my UG days, I used to read a hell lot of pathology. I've read books of it and everything. But it is not needed in that much depth when it comes to entrance exams. So I was someone who started up reading the main notes of pathology. Then I also opened a province, I remember, for a while. But then you need to remind yourself that agar ye pucha hi nahi jayega, what's the point of reading that? When you have to cover like 19 subjects, that too, like, yeah, you have to touch upon everything.
So the way you said कि अभी Robbins खोलने की जरूरत नहीं है, but when you were in your college days, what do you feel कि reading those books during that time is important or not versus now? Because I have seen this pattern that from second year onwards, people start preparing for NEET PG. And they start just watching video and stop reading book. And do you feel that somewhere it's impacting in building the concept? Because end of the day, along with passing the exam, you all have to become a doctor too, who should have knowledge.
So I won't say I've read every possible book that's there, not for every subject. So for me, it was like, if the subject was difficult, / if it like interested me a lot, I definitely used to switch to the textbooks of it. And I feel that one should read textbook as much as possible, because I don't know, it gives you a certain sort of confidence. I mean, even if you'll ask about something in pathology from me, I most probably I have that confidence that I would be able to answer it based upon my knowledge. I mean, yeah. So one should definitely, like, at least in your UG days, one should give time to the textbooks also.
So how was your UG days? Matlab, like what kind of student you were?
Okay, so my UG days were like pretty chill, I will say. I did study. I mean, I used to give proper time to studies, but I did not miss out on life at all. I've done everything. I had a like great friend circle in terms of like padhai wale bache bhi the. Then there were the people we used to bunk classes. We used to like go. So thankfully my college was in Haldwani, which is like 40-45 minutes away from Nainital and all the hill stations. So
My college was in Dehradun, so I
oh,
know.
okay, you can relate then.
Yeah,
Yeah. So like every weekend we'll go to some hill station. Then I've done every possible crazy thing I can think of right now. And matlab, when I got a rank of 9,000, honestly, I used to have this guilt. Okay, maybe if I would have studied better, I could have performed better and everything. But now it feels every bit of it was worth it because it is like once in a lifetime sort of an experience. Even in my internship, I did give time to my studies, but then I also attended all the parties, all the birthday parties, all the trips. We went to Goa also. So yeah, everything was like perfect. And now it seems everything makes sense.
fair enough. So at least you also believe in that during your UZ days you have to study, but at the same time give time to build your personality and
Definitely.
other components as well.
Yeah.
So when you are preparing this post-internship attempt, you are preparing at home or you have joined your library, and how was was that monotonous?
Okay.
So how was that the whole time?
So as compared to everyone else, I started preparing pretty late because I dropped my seat in mid-Feb. And I was like in my senses to prepare by March, 1st of March. So there was not a lot of time left. I studied at home only, though I asked my father if I should take up a job or something. He was like, if there's not much time left, maybe just sit at home, prepare for it, everything. So yeah, I prepared at home.
And how do you deal with that period of burnout, monotonous? That
So I have a lot of hobbies. Honestly, I like to cycle. So
a good one.
yeah, I used to cycle. I like to cook. I used to cook. Then I like to read. I have finished 2 novels in this prep phase also. I've finished 2 shows also, Modern Family and Ken's Convenience Store. So yeah, I mean, you need. So what I believe is when you're doing something, you should be 100%, at least 80% invested into that particular thing. If I'm watching something, if I'm taking a refreshment break sort of a thing, I should not have the guilt that I'm losing my time, I'm wasting my time. It should not be like that. So yeah, it was pretty good. I mean, I enjoyed being at home around my parents after since a very long time. So yeah, it was good.
Nice. And you have a good, so how was your peer support or the community looks like? Do you have a good friends or maybe there's a variation that somebody motivates you, demotivates
Yeah.
you? How you manage that?
So I was not in touch with a lot of people, honestly. So when I dropped off my seat, there were a lot of questions from everyone. So I just switched off my phone. I changed my number, everything. But yeah, I did approach to a few friends of mine from my college, and they've always been very, very supportive. I mean, I do not have that sort of confidence on me as much they have. So they always used to like reassure me, "Tu nahi karega to select something like that." Plus, my family was pretty much good. I mean, they used to try a lot to like break the cycle and stuff, like interrupt. I won't say interrupt in between, but yeah, like sort of a break. Ke thoda bahar jao, let's go to a restaurant, something like that. Plus, then there were Telegram groups also on which you can, I mean, rant out at times. I mean, there are academic groups, but kya ja raha hai? You can rant out anytime. So yeah,
So what do you feel about Salaah Shots? Like what's your view on that and how it had helped you?
I feel it was pretty good for me at least. I mean, it did work. So there are a few things I feel which I lack, like I told you about that assurance factor. I want someone to, matlab, theek hai, even if the plan is perfect, I want someone to just analyze it once. और मुझे बोल दे, हाँ, it is good, you should follow it. So that void basically was filled up by Salaah Shots, like solely. And Anisha I contacted her like 5 or 6 times from via Salaah Shots. So it was very, very helpful for me.
So if you have to tell Salaah Shots to anyone, what would be your view on that?
I would definitely recommend it. I mean, everyone can have different needs in this prep phase. Maybe like I wanted that reassurance. Someone might want the guidance about resources or planning and everything. So based upon that, you can approach the mentor, and they're like pretty good. I mean, it makes very much sense because they've done it themselves, so they can guide you better.
Right. And like, what was your difficult subject to deal with? Like, everybody one have a favorite or a like a not so
Yeah.
favorite subject. What was yours, and how you have managed that?
Okay, my difficult subject was opthal was one. I mean, it's for everyone. I feel ophthalmology was one of my most difficult subjects. Opthal and ENT. I mean, ENT is interesting, but then it's boring, so I don't like reading it much. Opthal is neither interesting nor. I mean, I don't know. Opthal is not a good subject. I feel how I dealt with it was I made one single PDF. I used BTR as my base. उसके ऊपर I added on questions, PYQs हो गए या GT questions हो गए. And my mindset about Ofthal was I have to attempt questions which comes within this. Those I should not be getting wrong. अगर इससे बाहर कुछ आ रहा है, I will not take any guess. I'll plainly leave it. That was my approach. Either attempt or leave. That's all. ज़्यादा दिमाग
And
नहीं लगता है.
and that time you don't have FOMO कि मेरा रह गया तो क्या
Yeah,
होगा?
exactly.
So apart from this, you said that you have a lot of hobbies to do about. So can you just share that how you maintain your hobbies and something about your hobbies? What all do you like to do?
Okay, so like I had a very keen interest in literature, telesay. So I used to read a lot of novels, English novels. Then I also I still do write. I used to write poetry. I have published it thoda thoda. Uske baad I've also performed. I am a spoken word poet, and during the pandemic time, I was at home. And the best part was all the international organizations have opened up their portals for everyone because it was all online, nothing was offline. So in that, there's this Get Lit Poetry. It's a Los Angeles based group of poets or something. So in that, I was an honorable mention from India
Oh,
in
wow.
2021. Yeah,
Congratulations.
thank you.
So there's something we can listen from your poetry if you have something handy.
Abhi, okay, wait. It's nothing motivation or something. So
It's okay.
yeah,
Poetries are poetries. I too like writing, but it's
okay.
mostly about for me to write, to listen, to read about.
Yeah, this is about mental health, about depression and stuff. So it's on Insta also, though. I'm just reading it out once. It says, it goes like, I gave up on memorizing my last poem. And my mom says, you learn the things easily that you write. I remember how it's not a poem, but a filtered compilation from the poems I heard last night. How I chose the lines where the soul sat on their tongues, picking up their throat lumps like red grapes, arranging them with a personal approximation to create a likable feeling of depression. Because writing my own would mean a tattoo on my brain folks, and my mom won't let me learn how I feel.
Huh. So do you want to share about your mental health journey, how you have managed that? Because
Uh, okay.
there's so many of us going through that, but nobody is openly talking about it, feeling alone, stuck.
Hmm.
So if you can share about it can give a lot of hope to so many.
Thankfully, I had a like amazing group of friends. I cannot thank them enough. They have changed me as a person completely. I was very nerdy. I mean, when I entered the mid school, I was super nerdy, just into books, either novels or academic books, nothing else. But they did like bring out a good version of myself out there. So when I opened up to them about this, they were pretty helpful. They were very much willing to help me in any way possible, which in itself was very. I mean, I'm very thankful to them for that. Uske baad I took the professional help also. I'm glad I approached at the right time and everything. So things started a bit sorting out. Uske baad I used to journal, then I used to write. So yeah, poetry is a very good medium to like bring out stuff which is in you. So yes, then uske baad I started spending time with myself. Like it's not loneliness, but I used to enjoy that time with myself. I started solo traveling. I went to Rajasthan solo. I went to Himachal, Uttarakhand also. I've been solo traveling about it. But that feeling never got away. Honestly, it never goes away. I mean, there are people who think that these things are curable. It's not. It might lessen, but it won't go away. So the best way would be to make a, make a good relationship with it. If you're feeling something, feel it completely. I mean, if you're feeling something, just write it down. Use it in a more, constructive way rather than a self-destructive way. That's what I've learned so far from my journey. Then I also had a very good therapist. She was also like super supportive and she was super happy with my rant. I told her about this. So yeah, now I've been doing very, very well. I mean, in terms of mental health, I'm pretty much open about it. Pehle, I used to think it's a huge taboo, obviously. So, but yeah, now I'm doing very well. And I cannot lay enough emphasis on the fact that mental health should be your priority, especially during the preparation phase. I've talked to a lot of people from Telegram because I talked about this on Telegram group also. So a lot of people approached me and they are suffering. Like, I mean, I feel I've come out in a very healthy manner, but people are still stuck deep down. I feel you should take help whenever it's needed. Even if you have to go against your parents about this, that's completely okay because at the end of the day, you know what you're going through. So you should be there for yourself. And uske baad, plus this exam, I mean, now I've cracked it. People would say कि ऐसे ही बोल रहा है अब तो. But this exam is just an exam. It's not your entire life. It's just a part of your life. You should take it that way. And if you take it that way, then only you can like do well in it, I feel. And yeah, you should like prioritize yourself at any point of time. Definitely.
Very fair. Like, I completely agree to your point that this exam is a exam of wisdom, not your worth.
Yeah.
Because you're already a doctor, you're not anybody out there. And even if you are, you have to take care of mental health because only when you are happy you are able to take care of any patient. It's a profession of care. It's a profession of service, and in to do both of these, you have to be in a better, good, healthy state.
Yeah.
वो बहुत important है. I too have come across lot of students who are in a very shitty state right now.
Right.
They're not getting the help also, and they don't even know how to take the help also. They are
Right.
feeling ki this is normal. I just get this is a recent survey which we have circulated in the colleges. Like almost 80% of them from the third or fourth year student, they are like ki, we are done with our life. We are feeling bad every day, and now we are just like doing nothing because we don't know what to do, and we're just sleeping with it every day.
Yeah. I mean, it's very difficult to deal
It's
with.
difficult.
But you need to get out of it. I mean, there's light at the end of the tunnel. You should take appropriate help whenever it's needed, whatever it costs. It doesn't matter that much.
So what do you feel, Kartik, what all plays a very important role in people to come out of it? So if I have to do something for the people,
Yeah.
because we are thinking about from a very long time that apart from along with professional matlab, a career point of view, we should
Yeah.
add a component specially for doctors, like mental health for doctors,
For
be it the PG or be it for the college students, because
Yeah.
they have a very different system altogether in the colleges and the residency. So
Yeah.
what will help a doctor to come out of it?
I feel, I mean, so what I firmly believe, like, this profession is just a profession. It's not your life. Your life is way bigger than this. I've seen people, I mean, I'm not at that stage that I've seen like a lot of professionals, but as much I know, there are a lot of people who invest a lot of their time and they feel like this is everything to them now, which is not. I mean, it's a completely wrong notion. You have a family who loves you so much. So you should just take it as a profession, first thing. Second thing, physical exercise is very much needed. I am someone who's very lazy. I still did it. So if I can do it, anyone can do it basically. I used to like cycling. So I used to do cycling, then I used to go for walks. Physical health is very, very important. I mean, both of them are actually correlated as studies have shown. Then third, you should have a healthy peer group. It shouldn't, I mean, that is your criteria to decide what your definition of healthy is. But it's not like कि अगर वो बहुत अच्छा पढ़ रहा है और he's doing very well in his life, he has to be your friend. ऐसा नहीं है. I mean, मतलब, the kind of friends I had, they were very, very supportive. They were always there. I mean, I can even say that even if I won't have met them, I would have been in a very, very bad headspace because I've seen a lot of toxic people too in my college. and you should be like getting away from them. Third thing. Then fourth thing, which helped me a lot, was journaling, because I also write poetry. That was a way of like bringing up things. Then journaling is very good thing. In journaling, if you want to start as a basic, what you should do is you should just make like five pointers daily ke banao. Usme you should write what you did today, and whatever you write, you should feel proud of it. Okay, matlab, you are like progressing every day. You're doing better and better. So that is more of a checklist to your own self. Okay, see, I'm doing much better to this. Plus, you should not ignore it. I feel even during my last 10 to 15 days, I told like there was some family emergency, so there was a lot to cry about, honestly. So what I did was I used to stick out this a piece of paper on my table. Usta I used to write whatever I'm feeling in one line or two line. फिर रात को 10-11 बजे after I've had my dinner, I'm like कि हाँ इतनी पढ़ाई होनी भी हो गई है. I used to read those. I used to analyze and cry about it. I mean, if it needs time, it needs time. Even if you cannot give it that time immediately, make sure you give it time later. I mean, it needs to come out. Yeah, definitely.
Yeah, that this is really a good approach, because something needs attention, we should give it rather than being avoidant about
Yeah.
it. We should definitely give them enough attention, because emotions has to come out.
True.
Thank you, Kartik, for coming in, and it was really lovely talking to you, and especially the mental health part. I think everybody should learn that from you. And whatever will possible, we will definitely do it from our end, because it's all about being there for one another. So,
True.
lot to learn from your journey, and congratulations and all the best for your
Thank you.
residency, and a lot of power to you. I'm very proud.
Thank you.